You know that sharp, nagging pain you can get right at the base of your spine? It can make the simplest things, like just sitting at your desk or going for a drive, feel, well, almost impossible. If that sounds familiar, you're in the right place. Today, we're going to dive into what's really causing that tailbone pain and explore how specialized physiotherapy can bring some serious relief. I mean, think about it. That sharp, focused pain you feel when you sit down or shift your weight, or even when you just try to stand up. It's so frustrating, isn't it? And let's be real, it's not just a minor annoyance. This is the kind of thing that can totally throw off your entire day and just rob you of your comfort.
You know, the first step to feeling better is always understanding what you're up against. So let's put an official name to this condition. The medical term for persistent tailbone pain is Coccydynia.
So what is Coccydynia, really? Well, your coccyx is that small, triangular bone right at the bottom of your spine. When that area gets inflamed or injured, you get coccydynia. It's a condition that can really mess with your ability to move comfortably and just causes a whole lot of discomfort. So what causes this? Well, it's usually not just one thing. It could be something obvious, like a bad fall or the incredible pressure that comes with childbirth. But it can also creep up on you from everyday habits, like sitting for too long with bad posture, or even from hidden tension in your muscles that you didn't even know you had. Okay, now this is where things get really interesting. For a lot of people, the true source of their tailbone pain isn't the bone itself. There's this crucial connection that gets overlooked all the time, and it's pretty much the hidden key to finding relief that actually lasts. I want you to think of your tailbone like an anchor. It's not just kind of floating there at the end of your spine. It is the direct attachment point for a really, really important group of muscles.
And there it is. That's the connection. Your pelvic floor muscles attach directly to your coccyx. So when these muscles get too tight or overactive, they literally pull on your tailbone. And so often, that is the real root of the pain. Not the bone, but the muscles that are yanking on it. So if the pelvic floor is the key, how do we fix it? Well, this is exactly where pelvic floor physiotherapy comes in. It's considered the main evidence-based treatment because it goes right after the root cause, that muscle tension, instead of just trying to cover up the pain.
A great treatment plan is about looking at the whole picture. It all starts with a really thorough assessment to figure out exactly which muscles are causing the trouble. Then a therapist uses hands-on manual therapy to physically release all that tension. After that comes targeted exercises to get everything back in balance. And finally, some education on your posture so the pain doesn't just come right back. And this quote really gets to the heart of it all. This isn't about some quick fix. It's about a deep dive to find the true cause of the pain, and then using precise, expert care to bring your body back to a place of comfort and normal function. All right, all of this work builds toward the one thing we all want, right? Recovery. And the good news is, with the right approach, lasting relief is totally possible. So let's take a look at what that actually feels like in your day-to-day life. You know, improvement isn't just about the pain finally going away. It's about getting your life back. It means being able to sit through a whole movie without wincing. It means moving freely again. It can even mean improvements in other areas of your pelvic health. And ultimately, it's about learning how to manage your body to keep those flare-ups from happening again. And look, this isn't just a theory. This approach is built on a ton of real-world experience. We're talking about successfully treating over 2,000 complex pelvic pain cases. The evidence is pretty clear. When you get personalized expert care, you get results that last. So this all might lead you to a pretty important question. Is my pain serious enough to go see a professional? Let's talk about when it's really time to take that first step. So what are the big signs that you shouldn't just try to wait it out? Knowing what to look for is the first step toward a much faster and much more complete recovery. Here's a pretty good rule of thumb. If the pain has stuck around for more than a few days, if it gets worse when you sit, or if it's starting to interfere with your daily life, it's time to get it checked out. Seriously, getting help early is the single best way to keep this from turning into a chronic long-term problem. So the most important thing to take away from all this is that you do not have to just live with this pain. Relief is absolutely achievable. If you're ready to find out what's really going on and start your journey to feeling better, you can take that first step right now.